and welcome to Ask the Chiropractor. I'm Dr. Corey B. Rodnick, and I'm just very excited today. We've got winter coming. We've got great people with us. Dr. Toni Rodnick.
Honored to be here.
From Midland, Michigan. Dr. Paul.
Thanks for having me, Doc.
Hello there, sir. And Dr. Tamara Slusher.
Good morning.
Hi, good morning. So it's fantastic. I'm so glad we're all here. It's Oktoberfest when this is coming out here. November. October is what it is right here. So we're just ending Spinal Awareness Month. So I hope everybody out there had a chance to take a gander at what is so important about the spine and what chiropractors are always talking about. It's very important. It plugs us into everything, and the miracle of life is what's going through all these nerves and out to every cell in our being. They just came out with, because of that Spinal Healthcare Month, they just came out saying that 70% of all people in their lifetime, 70% will experience back problems, spinal back problems. Just back problems alone. We're not even talking about headaches and everything else. It's just alarming. It's like a pandemic thing here. So today we're going to talk about shoveling and winterizing and getting ready for the big shoveling. There's cartoons out with the big snowfall, and the chiropractor's looking out the window and go, oh, another crop of backaches. Why? Because it's snow season. But anyway, it goes much further than that. So Toni, you want to tell us a little bit about getting ready for winter?
Well, when you shovel, you remember what you're bending, and you don't want to lift and bend at the same time. So it's best if you push it. There's even ergonomic shovels that help you just push it out of the way. And when you go out into the cold, you don't want to be breathing in the cold while you're working out. So you want to put like a scarf or a mask over your face to stop you from breathing the excessive cold.
Absolutely. Like a warming up would be very good. What do you recommend for that, Dr. Paul?
We're just kind of piggybacking on what she's saying there. The big reason why you want to maintain your body temperature is your body only has so much energy to use for everything, and it splits it up to where it's needed accordingly. And a big thing that a lot of people get in the wintertime is they get sick. And what happens is the resistance gets lowered. The bacteria, the virus, the cold, it's around all the time. You can catch the cold anytime, but it's an opportunistic virus. And what that means is it'll only affect you when you're at a weakened state, when it can affect you. So if your body's using energy to maintain its temperature, it's constantly using energy to heat itself up, you have less energy to use in your immune system. So when you're breathing in that cold air, it's lowering your core temperature. When you lower your core temperature, your body's using more energy towards maintaining your temperature and less energy towards your immune system, and then you become, it becomes an opportunity for that virus to strike. That's why it's called an opportunistic virus. So what you want to do is make sure you're maintaining your temperature. Also, on the flip side of that, make sure when you're going in and out of the house, you're going from the heat to the cold, the heat to the cold. Same thing. Don't just throw your coat on. Make sure to zip it up, maintain temperature here at your core so that you're, again, staying healthy throughout the flu season, the cold season. It's not really a flu season or cold season. It's just a season where people don't take care of themselves enough and give the cold, the flu, the virus, the bacteria the opportunity to strike.
That's very, very poignant on right now as the temperature just starts to change, because some days it's warm and some days it's cold. So one day you're wearing a coat, one day you're not, and you're finding out you should have wore a coat because it's freezing out. I know I've run into that a few times, and I can feel that it does affect how much resistance you have. Like you said, we only have so much. That's if you're doing everything right.
And the big problem is that I see is people, it's more of a laziness than anything. Just throw your coat on. I don't need to zip it. I'm just going out for a second. And it's, you lose that temperature through your core, and it really makes a big difference.
Dr. Tamara, you want to tell us about the time factor as far as resistance goes, the time change?
Well, because it's getting darker earlier, one of the big important things is that our body is requiring more sleep. And a lot of people during this time frame don't get enough sleep. And as soon as you don't get enough sleep, that's one of the major components in why our immune resistance is lowered, and that makes us more susceptible to infection. So one of the biggest things that we need to do is allow our body the chance to rejuvenate the organs while we sleep. I mean, from 11 p.m. till 3 a.m., all your organs throughout the body have a chance to rejuvenate themselves. And that doesn't happen if you're not getting the proper amount of sleep. And a lot of people just try to go until the point of exhaustion before they finally go to sleep, and they don't sleep long enough. Our body requires us to have 5 to 8 hours of restful sleep. And how many people can actually say they're getting restful sleep? So that's one big thing that's important. Another thing too is because our body is going through a lowered immune response and we need to higher that immune response, we need to take more vitamins. We need to make sure to have the proper nutrients in our body. Some of our foods lack those nutrients. So this is the time when you need to take more vitamin C. These are the things that we need to do to boost our immune system so that we can be fighting infection better. So keeps that flu bug away.
Another vitamin that a lot of people are lacking this time of year will be vitamin D, and that's because vitamin D gets made naturally in your body when you're exposed to sunlight. This time of year, people are spending a lot less time outside, obviously because of the cold conditions. We're going to be getting snow here coming up. When you're not getting outside, your body stops making that vitamin D, and that's another vitamin that we're lacking this time of year.
Mm-hmm.
Let's talk more about like the body's resistance. Normally, if all is well and your resistance is up, you could pretty much fight most everything.
Mm-hmm.
And that's how you be around sick people and you're the guy who doesn't get sick. And so what is involved there? You said sleep and nutrients, eating well. What other factors are there?
For me, I always go back to what I do. The big one is
the dream.
Well, the dream.
That's what I go to.
Well, absolutely all the factors of the dream, but for me, the most important factor of the dream. Let me just fill the audience in on what the dream is. The dream, when you're living the dream, is when you're truly healthy, and it includes the 5 pillars of health. Dream, each letter stands for one of the pillars of health. So you got diet, rest, exercise, positive mental attitude, and maintenance of the spine. To me, the most important, though, is that maintenance of the spine. Your body has a system where it maintains itself, and it does it through the nervous system. So really what the M in the dream is maintenance of the maintenance system, is maintenance of the spine and nervous system. Your nervous system is so closely tied into your immune system that when you get adjusted by a chiropractor, we're actually freeing up the nervous system, allowing that nerve flow to flow more freely. By doing that, we increase the immune response. You give a boost to the nervous system, you also give a boost to that immune system, which is really important. Making sure that your brain and your body, and vice versa, your body to your brain are communicating properly so that everything is, you need more energy here, you need more chemical reactions there. Make sure the communication is there, and that really helps boost your immune system as well.
I've seen that miracle over and over again where a little kid comes in with pneumonia, or they're totally sick, and you adjust them, and like within hours, sometimes it's immediate.
I've seen, this just happened to me yesterday. I had a kid in the office with a fever, and adjusted the kid. Fever started going down right away. You can feel it, just hand on their head.
It's such a miracle. It's like unbelievable.
Well, it's our job. We have to keep educating parents too to understand why children don't need an antibiotic all the time too. There's a lot of kids that have been coming in the office that are on antibiotics, and then they get adjusted and they don't have to keep taking the antibiotic because now they're ridding their body of the infections that are going on. I mean, sinus infection is inevitable this time of year, and that's the one thing that you hear so many people say they come in with is they've had a sinus cold and they have the headache and they have the pressure and all these different things, and that they go to the doctor and that they have to get an antibiotic because it's not going to stay out of their lungs if they don't have an antibiotic, which is not true. We're talking about taking away that interference and increasing the immune response so that the body doesn't need to have any chemicals put into it in order to take care of that resistance.
She was talking about the lungs. Well, the body has a different way of getting rid of things like in the lungs. We cough. That's the body's way of getting rid of the toxins, getting rid of the viruses, getting rid of the extra mucus. And in our society, we try to cover up the cough. We have cough suppressants. We try to...
Cough drops.
Cough drops. We try to stop the body from doing its normal response to help itself. So that makes things worse, too, and then it internalizes, and the condition gets worse because the body's unable to clear it out and function properly.
So, go ahead.
Same with the fever that I was just talking about. The goal isn't to lower the fever. The fever is there as a positive response. That's your body's way of turning itself into an oven, cooking off the bacteria, the virus, everything that's going on inside of it. When I was talking about the adjustment, though, by doing the adjustment, when the fever lowers, it's naturally being lowered. A lot of people say, oh, my kid's got a fever, give him this, it'll lower the fever. The idea isn't to lower the fever. The idea is to let the body naturally take care of itself. And the adjustment, what it does is it makes it so the brain and body are communicating better, and it improves the response so it doesn't need to be at high temperature. The fever itself, it's uncomfortable, you're sore, you're achy, you don't like it. Absolutely, it's torture when you have to watch a kid have a fever. They're not enjoying it. You don't want to have a kid be uncomfortable. But the fever is not the enemy. Whatever is invading them is the enemy, and you want to make sure that they can facilitate that, take care of it as efficiently, as naturally as possible. Because when you lower the fever unnaturally, the body has to work around it, find different ways to fight off the bacteria. When the fever, again, isn't the enemy. Even though it's a bad thing, it's really a good thing. What we want to do is make sure the body can take care of itself as naturally as possible. And like we said, a lot of times it's instantaneous with the adjustment. You make sure the nervous system's working properly, and then the body has more tools, more weapons to fight it off.
So the body, in the wintertime, it's coming up. I'm thinking of all the things that can lower your resistance. And one thing that we're battling here is, again, you talked about temperature, keeping your body temperature up. The bacteria, there's different bacteria that likes heat, and there's different bacteria that likes cold, and there's other bacteria that likes it in the middle. And right at the time when it starts to snow and all that, there's different bacteria that starts coming out, and your body normally is resistant to all this by getting small doses, and your body reacts to it a little bit, and it builds a resistance against it. Naturally, this goes on every year, forever. And the human body builds up a resistance to this different bacteria. However, that's taking a little bit of our energy and lowers our resistance just a hair while this is all happening. Blood has to thicken up a little bit due to the, because it's colder out, that helps you stay a little warmer. Then also, that takes a little bit of your energy. And then the next thing you do is now we're bending and shoveling and raking right now. They're shoveling. And with the body mechanics of that times 10 going on, just so everybody knows, that from your middle back, where your belt line is, up to your upper torso, when you bend over, it multiplies by 10 on the weight factor of your lower back. So you bend over, if you have a 100-pound chest and upper torso, it would be 1,000 pounds on your lower back. And now you're bending over lifting a shovel, which might be 10 more pounds. You got to multiply that by 10, so it's really 100.
You really got to multiply it by more because the length of the shovel is so great.
It's longer, yes.
Yeah.
Yes,
so
indeed.
it's like in physics, the fulcrum, the distance from the fulcrum to the where you're applying the force.
So that helps to knock things out more. So now when you twist and turn and you start impinging on these nerves, that also lowers the resistance down. So, I mean, the whole body, to create a whole body, a human being, is about 9 months, approximately, give or take a couple weeks. Right? That creates a whole body. So you're replacing your body every year. Every year you get a whole new body. So you get a new bloodstream every 120 days. You get new organs, liver, spleen, kidneys are about every 90 days. You get the stomach lining is 10 minutes. So your body has to recreate all this. And now if you impinge different things, it's going to take a whole lot more work on that body to produce what it needed to do in the first place. So that lowers your resistance as well. Anyway, just talking about resistance here and other ways that it's possible during this time period to lower your resistance. You talked about sleep. I mean, that's a huge factor. And holidays keep coming up, so people are going to lose a little sleep there.
And there's more stress involved during the holidays too. So people stress themselves out to the point where exhaustion sets in too. You're not getting the proper amount of sleep that way as well.
And positive mental attitude. Every time you smile, 100,000 little white blood cells come rolling through the system. It's like amazing how this whole system works. And we just gotta pay attention and see what we can do. Like going last night, I was up till 2 in the morning, I was working. I think I missed that 11 to 3. So I know I'm going to have to do something today to make sure I don't keep knocking myself out. Today's not a great day to go out and party, right? Nope, it's not a good idea. So anyway, and different things like that happen. And how about car accidents at this season? There seems to be a whole lot more car accidents. In Michigan, if 50 to 60,000 deer accidents are going to happen just coming up right now. This is it, you know, right now.
And that's deer accidents alone. That's not counting the slip on the ice, your car hits the curb, slip on the ice, your car hits another car. You know, all that makes a big difference. And a car accident is so unnatural for the body just because you're either everything's moving in a certain direction, all of a sudden it stops, and then everything in your body has to stop at its own pace. Or you're going, you know, you are stopped and all of a sudden you get hit and everything just gets jarred separately. It's such an unnatural motion on the body. What that does to the spine and to the nervous system is detrimental. It's one of the worst things you can do. So talking about car accidents, that's something I always recommend. Even if you're in a 1 mile an hour fender bender in the parking lot, get into a chiropractor right away and get checked because everything gets jarred, everything gets moved separately, and it really has a detrimental effect on the body.
How does that lower your resistance?
So again, your brain and your body are constantly communicating. It's a cycle. Your brain says, send this here, send that there. Your body comes back and says, we have enough of this here, we need more of that there. So it's constantly communicating with itself. When you have a misalignment in the spine that pinches off on the nerves, you interfere with that signal. So it's kind of like a garden hose where you have something flowing through. You have signals flowing through. It can get pinched off in a couple of different ways. You can pinch off that garden hose in the way that you kink it. Now all of a sudden where the signal's trying to get through, all of a sudden it's weaker and it doesn't get there all the way, so you have less signal getting through. So it'll change things. It'll give you less. So an example will be low blood pressure. You know, it'll change it so your heart's not getting the right signal, so it's not beating the same, and your blood isn't flowing properly. Then you have a different way where it can pinch off on that nerve in such a way where it'll irritate the nerve. Kind of, again, going back to the garden hose, now instead of kinking it, now I'm putting my thumb over the end. Now it's spraying like crazy. Now, all of a sudden, I have too much signal getting through. That nerve is getting rubbed on, it's being irritated, and all of a sudden I have the exact opposite. I'll have high blood pressure. It'll be the same nerve pinched off, just slightly different way, and it'll affect how the body's working. So how it affects your resistance, you'll get, you know, less white blood cells. You'll have, you know, it'll affect everything.
Another way it would affect your response, your immune response, is if your body has to heal. You only have so much energy, and you're supplying some of your energy to the healing process. You might have, besides pinching nerve, torn muscles, or have some disc issues, and then your body has to heal those, and it doesn't have the energy to affect the immune system as much. So then your resistance goes down.
Mm-hmm. Pretty cool stuff. Who
Very
would have thought? It is interesting. It's unbelievable. I'm thinking when you said car accidents, and I might have said car accidents, but somebody said car accidents. It was, I can't remember when somebody has a car accident where they're not sick in the next 2 weeks. You know, within the next 2 weeks, I'm thinking like 90% of them, I can't remember very many of them not getting sick afterwards, cold or flu symptoms, something, because they got walloped. Pretty common, pretty common. That's because it knocks your resistance out. So what other factors do we have for resistance? And again, during this time period, it's like, you know, some people are a little depressed. I know a lot of people drink during this time of year. I don't know why, but and the resistance goes down because of it. So, you know, what you intake, eating the holiday meals, nothing personal, but I know that my hiatal hernia people, I get more of them between Thanksgiving and New Year's than ever. What a hiatal hernia is, your stomach has a tube that goes up. It's called the esophagus. So when you eat, there's this tube. It goes down your mouth, down into the stomach. So in between the stomach and your mouth, there's a diaphragm down in here, which kind of seals off the acids from the stomach. And that's how you get heartburn, is acids are coming back up into the esophagus, into that tube. So what happens is here you're overeating, so your stomach gets real big. Then you bend over to pick up your sock, and it shoves your stomach right up through the diaphragm a little and tears that. Yep. And then you go lay down, and everything leaks into the esophagus. Heartburn City. So probably not a good thing to do and should take care of. You don't want to leave it there.
Well, a lot of people are really, really active during the summertime too, and now they're not going to be as active. They become a lot more sedentary. They say that the average is you're 50% more sedentary in the fall and in the winter time. So with being more sedentary during that time frame, that's going to really affect you too, because then you get bored, so people eat more. And then when the holidays are over with, it comes to New Year's resolution time. And one of the biggest resolutions that's out there is, I'm going to work out. I'm going to eat healthy and I'm going to work out. So you ate all this junk up till that point, and now your body doesn't know what to do right away because you're trying to pump it full of all these things all at the same time and say, oh, I haven't worked out for 3 months, but now I'm going to go exercise. And I'm going to exercise every single day, you know, for an hour a day. And so those are things that really affect the body too. So that's what the average person does.
It's the
very
truth.
true. It's very
the
true.
truth to me is hilarious.
It's very true.
That's all I can say on that.
A lot of people
I've
don't.
noticed there's not as many people at the gym right now with me. I'm like one of the few people working out in the mornings because people go into sedentary mode now. That's just what happens.
A lot of people don't remember this time of year what they were saying this
Last
time of year
year.
last year.
Right. Yeah.
That's funny. Yeah, I write down my resolutions every year. It's on a notebook. You know.
What's number one? Lose weight.
So to do my new one, I don't really have to do anything. I just look back. I go, yep, that's it.
Haven't done that yet.
It's the same list every year for 30 years.
One of the things that's positive, though, and that you have taught me personally is instead of saying, I'm going to lose 10 pounds,
Yeah, it's
you need to
terrible.
start saying to yourself, I weigh this much.
Or I'm a skinny person.
I am a skinny person.
And then you
I
start
am
thinking like it and
yeah.
eating like
and
it.
this all rolls right back to the dream and the 5 pillars of health and talking about positive mental attitude. People are so gung-ho at the beginning of the year to do these things with resolutions, and they just got through majority of the holidays, and so they're like, the stress level's down a little, and they're so gung-ho, and they only do it for less than 30 days. And then after 30 days, they just drop down again, and it goes right back to the old cycle again. So one of the biggest things that you want to do is have that positive mental attitude throughout so that it keeps you going and keeps building your resistance up. It lowers your stress level, which increases your resistance.
Going back to the winter time, a lot of people, again, they're stuck inside. They can't get that exercise. It leads to that depression, which again leads to the eating. It's a vicious cycle. So right when New Year's comes, they say, I'm going to do this, I'm going to do that. And then they look out the window and say, well, I'll do it later.
I'll do it later. Next week. Well, I'll start next week instead.
Once the snow goes down a little bit, maybe I'll get out and take a walk.
Yeah. And I mean, we're in for a really, as they say, really, really bad winter, that it could be worse than it was last year. So people are starting to prepare themselves now and know that it's coming. So even more the reason to get your body in line and do the things that you need to do to decrease the interferences throughout the body so the nervous system can function as much as it possibly can, you know, going into this harsh winter. Because there are times when, I know as far as the beginning of this year went, there were times in February where we couldn't even get out of the house So if you can't get out of the house, and you know that you're going to be stuck in the house for multiple days on end, it's really important to try to do the things now that you need to build up that resistance.
You're talking about attitude. I just want for everybody. So I want you to think of red for a minute. Think of red. Okay, think of the color red. Okay, and I'm going to compare this to dieting and how to lose weight and all that, and how the subconscious mind works. Now, I don't want you to think red. Don't think of the color red. Don't think of like Santa Claus red. Don't think of any red, like a red bicycle or red shoes or red lipstick. I don't want you to think of red. So stop thinking about red right now. Red is not the color we want to think of. I want you to avoid red. Okay, many people at this point would be thinking red. Why? Because just saying red makes you think red. Now, that's like saying, I want to lose weight. What are you telling your subconscious mind when you say, I want to lose weight? You're telling yourself you're fat. Mm-hmm. Because if you're not fat, how are you going to lose weight? So to tell yourself, I'm going to lose 10 pounds, or I'm going to lose, you want to say this, I weigh this. Or, in other words, here, I want you to think of a blue shirt. I want you to think of a blue. I want you to think of a blue, like a blue sky. Can you think of a blue sky? You'll notice that red is pretty much dissipated while you're thinking of a blue sky. That's how you get your subconscious mind to work with you while you want to lose weight. So like Toni was mentioning earlier, I weigh so-and-so weight, I look and feel terrific. That's my goal as I say that. I don't say I got to get in shape. I am in shape. The most powerful words to the subconscious mind is the I am consciousness. They call it the God consciousness. I am, for there I am. I am. That's the consciousness you want to get to. So I am fit. Not I want to get fit, because as soon as you say I want to get fit, you're telling your subconscious mind, it's calculating this, just like the color red. It's telling yourself that you're not fit, or you wouldn't have to get fit. You follow me? So you start off your affirmations with, I am fit. I ride the bike 1 hour. Not I'm going to ride the bike. Going to ride the bike means you don't ride a bike. And that's what you're constantly bombarding your brain with, even though you don't even know you're doing it. Does that apply to anybody? Or?
Well, I just ran the Mackinac Bridge. I could have told myself, I might run the Mackinac Bridge. I might make it through this 5-mile run. Or you say, I am running, I'm doing this, and I did it.
I heard you tell me I am going to run the Mackinac Bridge this year. Mm-hmm. And then another time you said, I am running the Mackinac Bridge this year.
2 weeks after training, I did, but yeah.
That's what I heard you saying to me when you said it.
Yeah.
I remember a long, long time ago when you didn't run it, you said, I think I might try that this year. There was a difference.
Yeah.
Well, I knew you were going to do it only because that, you had an affirmation that was just rock solid. And that's how you want to run this whole winterizing thing. I am healthy. I do take care of myself. I am healthy. I lift properly. I shovel snow correctly. I wear my coat. Not that I should wear a coat. If you say I should wear a coat, you're telling your subconscious mind you don't need it. And at that critical moment when the coat is just sitting there, you leave it instead of picking it up. That's the only difference. It's like little minute things like that, and how to adjust your thinking. God, I love that stuff. Mm-hmm. That's my thing. Anyway, really, it's what got me through everything. Persistence, indomitable spirit, persistence. And anyway, so I think that's a great topic. Is there anything we want to say more on resistance, winterizing, and that could help the folks out there? A moment of silence. I think we covered that pretty good. So let's go into, again, I love that whole miracles of chiropractic. Just we were talking about it for a second. It just got me all excited because it's unbelievable. Some of the things is like incredible. Again, it takes 9 months to build a human being. So some of us are living to be 80, 100, 90s. You know, how many times have we rebuilt ourselves? At the rate of about we build about 2.5 million new cells per minute. We have about 75 trillion cells. And they're always being replaced because these cells only live so long. I remember when I was in school, when I first got there, the lungs don't ever rebuild. That was the big quote. Once you have lung things, if you smoke or whatever, your lungs will never rebuild. And I was in gross anatomy. I saw these lungs. I saw pink lungs. I saw gray lungs. I saw black lungs.
Black, yeah.
Wow. And I would take a history on where these lungs came from. You know, like, the guy lived in the city or somebody lived in the country or somebody smoked. So I got a little idea here. And the tissue itself, you could tell right away that obviously this thing's rebuilding itself. You could go, like when you cut through the tissue. So then they come out, yes, they do, but it's slower. And then later, the only thing that was left that doesn't rebuild was the nerves. Nerves don't ever rebuild. And I'm thinking to myself, when a guy loses his arm and they sew it back on and it still works, I wonder if the nerves grew back. Well, obviously they did. Or someone loses a finger and they can still do this. Of course they rebuild. Of course they rebuild. And then I got electrocuted 3 years ago. Man, I needed some nerve rebuilding and disc rebuilding. Most people don't know that their discs rebuild. Holy cow. Like every time you're moving, you're rebuilding. Every time you blink, you lose some eye cells. And then you go have a McDonald's French fry, and it turns, your body will actually turn that into an eyeball cell. Unbelievable. It's unbelievable.
Don't promote French fries.
Yeah. McDonald's paid me to do that. Okay, I'm holding the little box of French fries. Okay, so pretty incredible. I'm just so amazed by this. And so let's talk about the miracles of chiropractic. Again, that lung one with the little kids with pneumonia, I find that pretty thrilling. 3 doses of antibiotics, still not better. They come in, and within a day, healed. That's just pretty quick and miracle-y stuff. What's some of your favorites?
I just want to say, and chiropractic
doesn't always work that way, obviously.
A lot more often than not it does.
Amen.
But the chiropractic is in itself the miracle worker here. The chiropractic is just the facilitator, because what happens, your body has the tools. Your body is what takes care of itself. Your body is where the miracles come from. You have an intelligence in your body that's constantly running itself, regulating itself, taking care of itself. But it loses that ability when there's interference. What the chiropractic does is it removes that interference and lets your body do what it needs to do, what it's trying to do, what it should be doing. And the chiropractic really facilitates that process, makes it a possibility. But whenever somebody says, you healed me, thanks, doc.
Yeah, right. We had
it's not
nothing
me.
to do with it.
It's not me. It's not the chiropractic. It's you. You're the healer. If you were a dead body with that same problem,
it doesn't work.
Nothing I could do would do anything. Your body is what takes care of itself, and I just want to throw that in there. Chiropractic is a great tool, a great facilitator, makes it all possible. But without that healing force going through the body, nothing's possible.
You take a rubber band and you wrap it around your finger a bunch of times, really tight, and as your finger starts to get pink and then purple, then it would turn white, then black, and fall off. So what we do is we undo that, and all the nerves that are impinged upon, that's what we look for. And that's what we're doing, is we're uninhibiting, unpinching these nerves, and each nerve goes like a fuse box to all these different places. And so we're looking at it from that perspective. What we actually do is find nerve interference and reduce it. That's like the whole gig, right? Isn't that what you would say?
And if the rubber band's there, you can heat up the tip of the finger, you can ice the tip of the finger, you can stimulate it with electricity. Nothing you're going to do is going to stop the process that you described, because the circulation is cut off by that rubber band. And the same with the nerves. You can go to where the symptoms are and treat the symptoms, but that doesn't solve the problem. You need to remove the interference.
Going back to, you're saying the nervous system is like a fuse box. Absolutely. But it's kind of an unconventional fuse box. A lot of people don't put two and two together, where there's only so many fuses coming out, and each one's controlling a bunch of different things. It doesn't, this fuse doesn't just go to your lights. A lot of people say, the back pain, this hurts, that hurts, and that's what they put their focus on. The light's not working. But what they don't realize is that, that same fuse that controls the lights is also wired to the dishwasher. It's, that same nerve that's giving you the back pain is also the same nerve that's going to your liver. And a lot of people will, focus on the pain. I can feel it, so it's there. But they don't realize that something else is malfunctioning at the same time. So what we do as chiropractors, again, we find that nerve interference and just unpinch it. And we do a great job with the pain relief. A lot of patients come in, I get neck pain, back pain, but then after they've been getting adjusted for a while, they start to realize it's not only the pain that we're working with the nervous system as a whole. So they see overall results, better lifestyle results, where all of a sudden I am sleeping better. Even though I was laying in bed I was getting 8 hours, I wasn't waking up rested. Now I lay there for 5 hours, I wake up and I'm a new man. It really makes a difference. I feel like I'm digesting my food better. I feel like I'm getting nutrients. The body works as a whole when all those nerves are unpinched. And now the light's working again, but hey, now I can use the dishwasher, now I can use the oven. And it's the same nerves, it's the same wiring going there, but being pinched off here, when it splits, everything stops working. If you're not paying attention to everything, you only notice the lights. So really want to make sure to kind of drive that home. What we're working with is the nervous system, and the nervous system is overall, it controls everything.
Years ago they did research on men with prostate cancer, and one of the things was that 50% of all prostate cancers in males, obviously males, but it was a big thing because all research in the day back then was all on men. There was no research really on women, because the people who control the money in Congress, when they approve these things, were all men. Why would they want a study on women stuff? Okay, so Tony goes around. So it was a study on prostate cancer in men. 50% had chronic low back aches. Chronic. Meaning they've had them for years and years. So you have pinching a nerve down low back, which goes to the prostate, and then the prostate would malfunction and totally turn cancerous and things like that. So I found that as a very interesting study that they had done, and how, like you said, one nerve doesn't just go to your low back, it also goes to your prostate, it also goes sex organs, it also goes to the ovaries, and it also goes, so here you have, and I don't think that study's ever been done, how many women, with cancer of the ovaries or different problems.
They do have a study for how many women have miscarried, had chronic low back pain, and then after seeking chiropractic treatment and taking care of unpinching those nerves, have been able to carry full term since then. So, that is a very big issue, and that is one of the major reasons why I'm appealing to all women and always tell them, especially in the childbearing years, you need to make sure, even younger girls with having cycles and making them regular, but just making sure that, during your childbearing years and when you're pregnant especially, that you're keeping those nerves unpinched. You know, there's a lot of times where there's been a lot of doctors who have said, we just don't know why. You just lost the baby and we just need to clean you out, and that's just what happens. And there's an answer to everything. It's just a matter of figuring out what actually happened. And if the nerve is pinched off, just like you talk about the garden hose theory and everything else, the same thing is there's not enough circulation to the area. There's not enough flow going to the area. So, you know, there's not enough communication with the system the way it's supposed to be.
And then most people, again, like I was saying, don't put two and two together. They don't connect the dots. They say, oh, my low back pain, my low back pain. What do I do about my low back pain? Painkillers, muscle relaxers, you know, oh, it feels a little bit better. But they're not fixing the problem, and then they don't even think, you know, well, my back's hurting. I wonder if that's going to my reproductive organs. I wonder if that's going to my prostate, to my ovaries. You know, male and female, obviously, not the same person saying both those things. But they don't put the dots together, and then, you know, 5 years, 10 years down the road, they say, oh, a miscarriage, I don't know what happened, you know, it had nothing to do with this other problem, they're completely separate. They're not completely separate. Everything in your body is connected to everything else. Everything's working together. That back pain, that's your body's way of giving you a warning, saying there's something wrong here, there's something going on. And if you just ignore it, or even worse, if you just mask it, block it out with a painkiller or a muscle relaxer, you don't even realize it, but your body is slowly destroying itself. It's, you know, there's problems forming.
You know, I can't tell you how many times, well, in an examination, chiropractic exam, there's something called the history. And in the history, we're asking questions about their lives or what's, you know, particular to them. And I can't tell you how many times when talking to a female patient, and they'll say they don't have any kids and they're married, and I actually say, did you try to have kids? And they go, yes. You know, we've all had this, you know, yes. They go, we just couldn't have them. We've tried this. We've tried millions of things. And I warn them. It's like almost like a caution warning that if you didn't want to have kids,
get ready.
Then, you know, you might want to use some precaution here, because a lot of times when people come in here, they get their nervous system, that low back, the hips, the sacrum, something in there, and we'll adjust them. And within like a month or 2 months of care, they're pregnant. And it's like common. You know, then I tell them also that if you do get pregnant, it's okay, because I've had a few people quit. They go, well, I didn't know I could come in because I'm pregnant. It's like, oh my God. It's like the best time to come in when you're pregnant, because your whole body's changing like that. So you want to keep things lined up as much as possible. So anyway, I can't tell you how many times I've said that. And it's like a lot. It's like common. Yeah. That happened to anybody else? Or?
Yeah, one time I did have a lady walk in the office. This was before the fire, and so I was probably only in my second or third year in practice, and she was just screaming in the waiting room, "You got me pregnant!" And everybody turned and looked at me, and I was like, "Did you not want to get pregnant?" She's like, "I've been trying for years. I've tried in vitro. I've tried everything else, and nothing has worked. And we were just getting ready to adopt, and I found out I'm pregnant." And I was like, that's amazing. That's awesome. I said, do you know why you're pregnant? And then I explained to her about how her body is now allowing, that interference is gone, and allowing those organs to work correctly the way they're supposed to. And that's why she's pregnant. And she now understands. And she now has like 6 children. So, you know, I mean, you can go from being told devastating news and finding out that there is actually hope for things. The woman that came to me that had the most miscarriages, she's my age, and she had 6 miscarriages in a row, and she was done. She said, there's no way I'm going to even try again. This just cannot happen.
So sad.
Early 30s, and just, you know, was giving up hope, and within 5 months was pregnant and carried full term. So, yeah. And so she calls that her miracle baby, because that was when she sought chiropractic care after having all those miscarriages. And she actually just had like a dull low back pain, and just thought it would be good because she stands on her feet long periods of time in a factory, you know, and just wanted to make sure to keep the back pain under control. Never put 2 and 2 together that the back pain could be related to the fact that that nerve has been pinched for a long time, which is also a reason why her reproductive system was not working correctly. She wasn't having her cycles regular either. So, you know, that's one thing that we address with parents all the time is to ask if if girls who are going through puberty have had their cycles regular like they're supposed to. Those kind of things. So.
Now, I've had people bring in patients when they said, you know, their cycle is off and this and that, like bringing your daughter in kind of thing. And I've had that a lot. But very rarely does somebody come in and say, you know, I can't have kids. I wonder if you can help me with that. That's like almost rare, very rare, that someone will actually come in and say, you know, I heard chiropractic can help with that. You know, guys, just so you know, I know that, again, the 70% of all people are going to have backaches, but chiropractic started with a deaf guy. The guy was deaf. He was deaf. He couldn't hear. And he got his hearing back. That's how the whole beginning of chiropractic, that's it. Deaf guy, hearing.
The infertility problem could also be from the male. We've had males that got adjusted and then their wives got pregnant.
And on the flip side of that coin, we've had guys who got adjusted and their wives were a lot happier.
Yeah. Oh, my God. You know, it could be just something simple, like you were going down. I'm thinking of somebody right now. They're going down they were skiing, not skiing, sledding. They're sledding, and he hit a rock. Bam! Flew in the air, landed, and he couldn't have kids. And, you know, he sees a chiropractor once in a while for, you know, when he's dying. And he's not around me, or, you know, he's a couple hours away. But I think that caused him not to be able to have children because the sperm count was low. And, you know, you do different things. You wear looser underwear, different things like that. But unbelievable that, you know, I could trace it back to that moment. I remember him. I watched him flying in the air.
Well, this is
landed,
Michigan.
bam, on his back.
How many people go through injuries like that? You know, I mean...
We never think about it. It's just something simple that you wouldn't think much of.
Absolutely.
And then, you know, 10 years later, 20 years later, now you're an adult, you're trying to have kids, and that's a problem. I didn't mean to steer this into this topic, but, I mean, this applies to anything. You know, it's a little thing, you know, and then you end up with headaches. I had 21 years of headaches just from sleeping on my stomach. Because my dad would say, turn over and go to bed. You know, I'd be up playing with my brother at night, quietly as possible, and turn over and go to bed. Turn over and go to bed. Or I get a spanking after so many turnovers. Yeah, so he'd turn over, so I would fall asleep on my stomach. And I never thought much of it until I got rid of my headache one day while in chiropractic school. Woke up without a headache. I went down to the clinic, spent hours and hours trying to figure out what was wrong. I thought I was going to die because I didn't have a headache. It felt so different. Anyway, I said, something's different. I don't know what it is. Anyway, 21 years of headaches. So for all you stomach sleepers out there who wonder why you have headaches, that's it. And, yeah, I just got to keep both knees bent. So, yes.
I think a big part of the problem, too, like you were saying, you don't get that many people coming in saying, you know, we've been trying to have kids and I want chiropractic to help. A big part of the problem is that people just don't know. You know, there's not enough public education. That's why we do, you know, the show. That's why we get out in public and we do public lectures. To try to teach the public, you know, chiropractic's not just for the neck pain and the back pain. It's for everything. And a lot of people have all these problems and they don't even realize it's a problem, or they don't even put two and two together that it has to do with their back pain. You know, I have this problem and I have that problem, and for my back pain, I guess I might go see a chiropractor. But they don't put two and two together until it's starting to get corrected. Another one, just to kind of change gears here, going back to nutrients and digestion. Like you were saying, a lot of times you'll ask a history in the waiting room. Somebody will come in for back pain. One of the questions I ask is, you know, how often do you have a bowel movement? And you know, oh well, once a week. And to them, that's normal. You know, that's not a problem. It's okay, you know, once a week. But that is a problem. You know, if you're not having at least one a day, you're having an issue. And we started adjusting them, and oh, you know, my back pain's going away. And then, you know, a couple weeks later, a couple months later, they're saying, you know what, I'm feeling a lot better, and I've been, you know, my body's working more normally, and we get a lot of praise. Thanks so much. I feel a lot better. And it's not just the back pain that feels better. It's the overall. Everything's feeling better. And the public just doesn't know. People, a lot of times they don't even know they have a problem. But a lot of times they don't put two and two together that I have a problem and my nervous system might be the culprit.
When you said that, all I can remember is, it was, what was the name of that Bengal tiger?
Lila?
Lila. And so I'm adjusting
Layla.
this, what? Layla, yes. And I'm adjusting this Bengal tiger, the little baby tiger. And because it had torticollis, which its neck was stuck, so it couldn't walk, and it was in trouble. And so they flew it in from Texas. I'm adjusting. It made, I don't know, I think it was on CBS and ABC.
A white tiger.
And what's that?
A white tiger.
It's CNN. Yeah. A white Bengal tiger. So it made headlines, big thing. Anyway, so that was Thursday. They flew the thing in and the little tiger in. And so I just Layla, and by Sunday I was done, right? And this whole thing gets written up, and it's in. Oh God, they were running this thing like every hour, every 15 minutes. They were putting a little skit on, showing this Bengal tiger. Anyway, Monday morning, I have 6 people in the waiting room, all through Michigan, with their necks stuck like this. I look out the waiting room. I'm like, what the heck's going on out there? Bunch of crooked necks. So.
Because people didn't know. They just didn't know.
So they saw the thing on there, they related it, they're going to the chiropractor, and it was like, unbelievable. When the public finds out what we do, they're not going to let us close our offices. It's going to be so insane. Well, we want to also teach people how to take care of their spines a little bit with some spinal hygiene. And Paul and Toni, we're going to let you guys take over, and we'll be back in a little bit.
All right, and welcome back to Ask the Chiropractor. So now we're going to be showing you guys some exercises that you can do at home, something you can take with you. These exercises, these are called spinal hygiene exercises, and we call them spinal hygiene because just like dental hygiene, it's something you should do on a regular basis. We recommend you do the spinal hygiene as often as you do the dental hygiene. So you're getting ready in the morning, brushing your teeth, do some spinal hygiene exercises. You're getting ready for bed at night, brushing your teeth, do some spinal hygiene exercises. So these are great ways to keep your spine moving, make sure you're keeping your spine healthy on your own. So we're going to start off here with our 3 flying friends. These are the posture pod. We have 3 flying friends. We're going to start off from biggest to smallest and work our way down. So our first exercise is going to be called the eagle. What we do for the eagle and what we do for all the exercises, we start off in a position we call the inner winner position. This is called the inner winner position because we got our shoulders back, our tummy's tucked in, our head back over our shoulders. We're standing up nice and straight. What happens is if you've ever been to a sporting event, you see the people who lose the event, they're walking around like this. We don't want to be that. We want to be the winner, so we want to stand up nice and straight, keep that good posture. For the eagle, what we're going to do is we're going to start with our arms to our sides, and we're going to bring them straight up, flap our wings as we go up. We tilt our heads back and come on back down. Each one of these exercises you do a couple of times. We're going to do it again. As you go up, you take a deep breath in. You really feel your spine stretch out. And when you go back down, you breathe out, and you bring your head back down to neutral. Let's do it one more time. Really feel that spine stretch, and back out. Okay. And that one's the eagle. Our second flying friend, this one is called the hummingbird. And what we do for the hummingbird, this is a really great exercise for keeping our posture, bringing our shoulders back. We have too many habits these days, whether it's computers, driving your car, text messaging, reading, you name it. Everything that we do that makes our lives easier is hurting our posture. So this one does a great job of strengthening the muscles that hold up our posture. So again, we're going to be in that inner winner position. We're going to bring our arms up, and we're going to make small circles backwards. We're not going forward. We're just doing small circles backwards, focusing right between our shoulder blades, strengthening the muscles that bring our shoulders back. A couple of variations here. We can work a couple different muscle groups. You can just kind of bring it up a little bit. Same thing, bring those small circles backwards. You can bring it down a little bit. Again, different muscle group, just small circles backwards. Another variation of this one, it's called the drunken hummingbird. We're just going to fly a little bit crooked, get some motion into our spine as we're doing it. Again, everything you do equally on both sides. So we got the eagle, we got the hummingbird. The last of our flying friends is called the butterfly. Again, everything that we're doing is bringing our posture forward. You see a lot of people, elderly, that start to have this forward head posture. We don't want to have that. We want to strengthen the muscles in the back of our neck. So again, that same inner winter posture, this time we're going to link our hands together and put them back behind our head. And we're not pushing forward with our hands into our head. We're pushing our heads backwards into our hands. We're strengthening the muscles in the back of our neck. So just put a little bit of pressure, and then you can relax, and then put a little bit of pressure again, and then relax. And do it 3, 4, 5 times. Just really strengthen those muscles in the back of the neck. You can see we got our wings here. That's why I call it the butterfly. But just really strengthening those muscles. So those are 3 flying friends. Again, it's the eagle, the butterfly, and the hummingbird.
Again, with that last one, we want to breathe in as we're pushing back with our head and breathe out as we're relaxing.
Yep, absolutely. Next set of exercises we're going to do, these are called our star exercises. They're called the star exercises because we're going to turn our body into a star. So again, it's that same inner winter posture, but this time we're going to have our legs a little bit farther out, bring our arms up, and we're going to do here, we have 3 different exercises. We have one, the twirling star, and basically what we're going to do is just get motion into the spine. Every time we're moving our spine, keeping that motion there, it stops it from getting fixated and restricted, which really prevents that nerve interference. The next one we have is the tilting star, same thing, just getting motion of the spine. This time we're just going to tilt side to side. Again, keeping that motion equal on both sides, go this, each direction the same amount of time. Really just putting motion back into the spine. The last one's going to be a little bit different. This one we're going to do, this one's the twisting star, and this is actually a cross crawl exercise where we're using one extremity and the opposite extremity on the lower. So basically what we're going to do is we're going to bring our arms up, and we're just going to bring leg to our arm, and this actually forms connections throughout the nervous system. Really does a great job of developing neuronal connections. All right, and again, equal on both sides. And thanks so much, Doc.
Thank you. It's been a pleasure.
Absolutely. And this has been Ask the Chiropractor. We'll see you guys next month.